These are short 45-minute long sessions to help busy policymakers understand evidence on economic growth. I'm Megan Streb. I'm head of outreach at What Works Center for Local Economic Growth. We help to make local growth policy more cost-effective through better use of evidence and evaluation. Please do submit questions throughout within the Q&A option. At the end of the two presentations, we're then going to move on to a short Q&A portion. But with no further ado, we're going to hear from Naomi Clayton, Director of Policy and Research from the Learning and Work Institute.
Brilliant. Thank you, Megan. So I'm going to share my slides. You can just let me know that you can see them fine.
Great, thanks.
Lovely, brilliant. Okay, so I am Director of Policy and Research at Learning and Work Institute. Learning and Work is a not-for-profit organisation focused on supporting lifelong learning, full employment and social inclusion. And we do that by conducting policy research, testing out different approaches and trying to build the evidence around what works and evaluating programmes too. So I'm going to talk to you a bit about kind of what we're seeing in terms of economic inactivity in the UK. So that's people who are not in work and who are not actively looking for work, and then talk about what effective strategies for supporting people who are not working and not looking for work to find and stay in employment. So a few reflections from me on that. Particularly as local areas are tasked with creating Get Britain Working plans, and mayoral combined authorities are obviously leading the Trailblazer programmes. So just to start off by looking at some of the data. So you've got two charts here. The one on the left is from the Labour Force survey, which shows economic inactivity by the main reason why someone is out of work. And we can see that since about 2020, ill health has become the main reason why people are out of work, and recent rises in economic inactivity have really been driven by those rises in long-term sickness. And this is linked to particularly sharp rises in mental health, and the other main kind of long-term health condition is musculoskeletal conditions. I've also included the out of work benefit data from the DWP here, in part because we know that the falling response rate with the LFS means that it's less reliable as a source of data and information on the labour market at the moment. But the benefit data shows that actually we're seeing that quite significant rise in the number of people who are claiming health-related out-of-work benefits. So at the moment, around 3.2 million people claim health-related out-of-work benefits. And since the pandemic, the number of people claiming those health-related benefits has increased by about 37%. So there's a big issue in terms of health and people being out of work due to long-term health. The LFS estimates that there's around 2.8 million people who are out of work due to long-term sickness. In terms of what we're seeing in terms of out of work benefits claims, I think there are a few contributing factors there, particularly in terms of that increase that we've seen, which includes the ageing population, the low level of benefits for job seekers, which pushes people who have underlying health conditions to seek health-related benefits, which are higher, and obviously the growing pressure on the healthcare system too. But an estimated 1.7 economically 1.7 million economically inactive people want to work. But at the same time, just 1 in 10 out of work disabled people get help to find work each year. So there's a lot of people who are out of work and who want to work, but relatively few who actually get support to find work each year. I should say, obviously, focused here on the rise in economic inactivity and benefits claims that are health related. But whilst kind of long-term sickness is kind of what people give as their main reason for being economically inactive, there are likely to be other causes too. So it might be that people think that the jobs that are available are not suitable for them. They may lack the skills for the work available, and they may have caring responsibilities too. So people often face multiple barriers to work, and of course policy and practice needs to ensure that people are getting the support they need on a personalised basis rather than just focusing on a single issue like health. So just to look at how this plays out across local areas. So here we've got the proportion of people who are economically inactive and long-term sick by kind of very local area. I think this is local super output areas. So kind of different neighbourhoods. And you can see there are quite a lot of diversity both between local areas and within local areas. So, you know, in parts of Surrey, just 1 in 100 people will be economically inactive due to long-term sickness, where in parts of the Merseyside, that rises to 1 in 7. And there are multiple reasons for this. In part, it relates to the nature of those local economies and the buoyancy of those local economies. But it's in part driven by housing. So we see quite high levels of long-term sickness and economic inactivity in social housing for obvious reasons. But it's worth just pointing out that 1 in 4 people who are economically inactive live in social housing. That rises to more than a half if you're looking at people who are economically inactive due to long-term sickness. And that's linked to kind of various kind of associated disadvantages. You know, people in social housing are twice as likely to be disabled, more than 3 times as likely to be lone parents, or to have no qualifications. So all of that plays out to in quite significant variation, both between and within local areas. And obviously, it's really important to use data effectively to identify and engage the people who could most benefit from support. And obviously, particularly given the fall in response rates to the LFS and the impact that that's had on its reliability, it's really important to draw on multiple data sources, including admin data, to really understand kind of that local need and local variation. So just to go on to the kind of principles for effective support, we've kind of conducted several kind of large evidence reviews and evaluated quite a few different types of intervention. And what that shows is the inclusion of people with lived experience is really important when you're kind of designing interventions and thinking about how best to target interventions. So kind of policies, programs, and guidelines are likely to be kind of more effective and better received if they're informed by the needs and perspectives of those who are likely to be affected by them. It's really important, obviously, to consider how incentives drive behaviour and to give careful consideration to how changes in policy and the introduction of new programmes are likely to interact with the wider system to ensure that it doesn't have unintended consequences. For example, we've seen that, some wage subsidy programs have been found to have short-term positive effects, but limited longer-term impacts on people's employment prospects. So it's really important to conduct quite thorough impact assessments, to use pilot programs to test out different approaches, and potentially to use phased rollouts to kind of test the effects of different interventions, and crucially to kind of regularly kind of monitor and evaluate outcomes too. We know that also early intervention and consistent support is really important, and providing that opportunity at the earliest providing support at the earliest opportunity really does work to reduce the risk that somebody will stay out of work over the longer term. The other thing is the integration and collaboration with partners, and we know that that's one of the benefits of working at the local level and the benefits of devolution, the ability to bring different partners together and collaborate and coordinate across programs, and it's particularly important when you're focused on supporting people with kind of complex and additional needs. I mentioned earlier that people are likely to face kind of multiple barriers to kind of finding and staying in work, and kind of coordinating support is really important there, not just to make sure that people are getting the right support, but also that support is being delivered in the most effective and efficient way. And then just lastly, one of the consistent things that comes up across evaluations and the kind of broader evidence is the importance of personalised support. So providing that intensive, tailored support to individuals with kind of wraparound support that addresses those multiple barriers. So that personalised support is absolutely key. But of course, I talked about the importance of kind of coordination and collaboration. What we often see, particularly when we're looking at the employment and skills system, is that there's a quite high degree of fragmentation. So I just wanted to delve a bit deeper on that point about integration and coordination. We conducted a mapping exercise a couple of years ago in one local authority, and we found that there were 85 different organisations and programmes providing employment support and skills training in that one local authority alone. So programmes delivered by Job Centre Plus, DWP, joint DWP Department of Health and Social Care programmes, councils, colleges, social landlords, independent providers, and of course third sector organisations too. What that means is that kind of proliferation of different programmes and support means that quite often the system can be quite fragmented and difficult for individuals and businesses to navigate. And that can lead to gaps in provision and the duplication of services too. And of course, inefficiencies in terms of the use of public funding. We quite often see that employment support and skills provision is siloed too, which is a particular issue when we know that over half of people who are economically inactive and not in full-time education have no formal qualifications. And of course, new programs like Connect to Work, the expansion of the individual placement and support programs require better integration of employment support skills and health, and is critical if we're going to support people who are out of the labour market to find work and stay in work. And of course, there are different ways of doing this. There's a lot of focus on co-location of services, so bringing together employment support, careers information, advice and guidance, skills provision, alongside other kind of more bespoke services to help people find and progress in work. And you've seen different local authorities and partners take that approach, including kind of Walsall, who've got a partnership-led facility called The Link. You've got the Hub in Gloucester, and various employment and training hubs in parts of Tees Valley too. So there's lots of examples of co-location, and examples of local partners trying to integrate services more effectively and taking this kind of no wrong door approach. So the idea with that is that whatever kind of service or organisation somebody's coming into contact with, they can get the support that they need. And you've seen examples of this in the UK and also in the US. One particular example to highlight is Sunset Park Alliance in Brooklyn, and there was a big focus there on developing the kind of no wrong door approach to support young people into employment, with the focus on kind of fostering collaboration between organisations, engaging the community to understand needs, systematically mapping existing services, and making sure that there were those kind of multiple access points and referral networks, because I think it's really important not to rely on just having kind of one physical hub that relies on that person kind of going to that location, but making sure that there are those strong networks and referral mechanisms. Part of that is the kind of integration of services, and we know that kind of training staff is really important. Co-location is obviously an important part of kind of better integrating services and developing those kind of really strong partnerships at the local level. I would just say, I'm conscious of time, but thinking about how employment support and support for people who are economically inactive, thinking about how that interacts with other policies and fits as part of local growth plans is really important too, because things like housing, transport, planning have an impact on people's employment outcomes. I think there's something, and I'll just touch on this quickly, trying to reach many of the people who aren't getting employment support at the moment, who maybe aren't in touch with the benefit system, means thinking a bit differently about how to engage people, because we know that there can be limited interaction with the employment support system. We think there's an opportunity for proactive engagement as people are moving off employment and support allowance, so ESA, and transitioning to universal credit. We think that provides an opportunity to offer people employment support and a conversation about work. But I think what we've seen is that it's just really important to work with kind of reliable intermediaries, those kind of trusted organisations who are already in touch with people. So community groups, housing associations, healthcare professionals. and to use kind of peer networks and community advocates too. But it really does take time to build up trust and engagement within local economies. And just to quickly touch on the role of employers, I think, you know, we're not going to change the dial unless we're working with employers, and it's really important there to build quite a collaborative relationship with local employers that kind of works to open up job opportunities to people and to treat employers as kind of customers and partners and involve them in the kind of co-design of different interventions and the delivery of programs too. Should mention that, you know, there's a lot of work ongoing in this space. A lot of local areas have dedicated business engagement managers and engagement specialists, which is really important in developing those relationships. And, you know, the West Midlands Combined Authority has the Thrive at Work scheme, which works with employers to help them create more inclusive workplaces, which is, again, really important if we're going to ensure that there are those job opportunities available for people. And then lastly, just to say that obviously data is really important in terms of identifying and engaging the people who are most likely to benefit from support, but also understanding whether support is making a difference. So it's really important to kind of develop data sharing agreements with DWP and partners to make sure that you have good kind of management information and data available, and important to test and learn. So if you're taking a new, particularly if you're taking a new approach, evaluating that program to understand whether it is working as intended is really important, so that we make sure that we have those kind of feedback loops in the system. So I will stop there because I'm over time, but very happy to take any questions when we get to the Q&A.
Thank you so much, Naomi. So we're now going to hand over to Victoria, our Deputy Director of Evidence, to talk a bit about what worked.
Thank you, Megan, and thank you, Naomi. Bear with me 2 seconds. Okay, Megan, shout if the slides aren't appearing, but I'll work on the assumption that they are if I don't hear otherwise. Okay, so I'm just going to talk very briefly about thinking through what your local policy responses might be. So I think that this will come as no surprise to anyone that the first thing that I'm going to say is, you know, figure out what the scale of the issue is. So I think there's a question about how many people are economically inactive in your area, but also really understanding what the profile of the economically inactive individuals is. So what I mean by that is partly, why are they inactive? You know, so Naomi talked about earlier about how one of the groups that we've seen big growth in is those that are inactive due to health issues. But there are other reasons why people are inactive. So I think understanding that, but also understanding the profile in terms of their characteristics, you know, gender, age, you know, Naomi talked about how actually there's a big overlap with those living in social housing. So all that kind of information can be really useful in terms of actually targeting your policy responses effectively. I think the next thing actually is then to understand a bit about what you've already got in terms of current provision and figure out where the gaps are. As Naomi talks about, there's lots of different players involved in this sphere. There tend to be quite a lot of things happening, at least in some areas. So if you're looking to intervene, actually understanding where there's a gap, where you can usefully add to things that are already ongoing, is a good next step. In terms of the actual policy options, I think this one's a little bit tricky for us, is what works growth, you know. So obviously having a high proportion of your population in employment is key to economic growth. So that alongside productivity are the two things that will drive economic growth within an area. But realistically, many of the interventions that you are going to need aren't really things that are traditionally part of the economic growth, policy field. They're in other areas. So there are things around health and mental health services, housing, money advice, childcare, and also, how do we deal with elder care as well, increasingly. So because they're in other areas, what that often is going to mean is in terms of you're going to need good partnership working, you're going to need good collaborations across the public sector and the third sector in terms of being able to effectively address these issues. When we move on to the ones that are more kind of core to economic growth policy, we're really talking about labour market issues. So I've kind of split that out into two categories. So if we think about skills as being the key thing that an individual is selling within the labour market, I think thinking about how can we improve skills is a useful framing. So that can be about things like training, work placements, volunteering. There's lots of different kind of mechanisms that can be used there. But I think it's also worth thinking about not just vocational skills or even the kind of basic skills, so things like numeracy or digital literacy, but also thinking about the skills that help connect people to the labour market. So things like job search and interview skills. And that falls into what I would consider a kind of broader basket of interventions, which are things that help improve connections to labour markets. So things like work placements, again, if actually you've got that experience of going into the labour market, you've been exposed to an employer and an employer has been exposed to you, then actually that can be quite a good route into work. I think Naomi talked quite a lot about employers, so I'm not going to kind of, talk too much here. But I think it's also quite important to think about, what do interventions need to do in terms of understanding employers' needs, but also managing expectations in terms of what an individual might be able to do when they move back into work. One final thing that I want to say in the policy options is this isn't going to be true everywhere. It's almost certainly not true in Surrey, where only 1 in 100 people are economically inactive, but will be true in some of the places where a much higher proportion are economically inactive. But in some places, low job density, so there not being enough jobs, is also potentially an issue. So it's also worth thinking a little bit about the interventions that you might need in terms of growing labour demand. Now, that's not going to directly help an individual move into work. You're still going to need all of the other things that we've talked about. But if you've got jobs available, then that definitely is going to help with the overall position. So just finally to say a little bit about our resources. So we tend to focus on evaluations of intervention. So we're always asking, does intervention X lead to outcome Y? And what that means is that none of them focus specifically on economic inactivity. But what we do have is we have a range of reviews that we've done of interventions that are potentially going to be part of your toolbox in terms of helping economically inactive individuals move into and, importantly, progress in work. So we have evidence reviews and toolkits on apprenticeships, on employment training, which is actually a bit broader than it sounds. It includes both training and work placements and things like job search within it. And we also have an in-work progression toolkit, which is interesting because some of the evidence in the in-work progression shows that in-work progression interventions are particularly useful with the most disadvantaged individuals, which we're likely to see within this group. The one other thing on this I would flag is last year we published a review we did on the impact of different growth policies on minority, ethnic and immigrant groups. And that includes some stuff both from apprenticeships and employment training. And then we've got a few other things that you might want to look at. So we did some stuff last year, or possibly the tail end of the year before, looking at kind of good jobs. So we have an evidence briefing on fair employment policies, and I linked to that a rapid evidence review on local minimum wages. And the other thing that we've got is a toolkit on increasing take-up, which I think is quite important in this field, because as Naomi touched on, quite often these individuals won't be engaged with employability services in the way that someone who's unemployed might be. So thinking about how you increase take-up can be helpful in terms of improving the effectiveness of these policies. But I will stop there so that we've got some time for questions and answers.
Right. Thank you so much, Victoria. If I could invite Naomi to come back, and also invite our director, Henry Overman, to join us. So we've had a couple questions. Please do ask away. We'll start with the first one. So personalized support sounds comparatively costly in a tight funding environment. Are there any findings or just general thoughts about cost benefit of this approach? Naomi, is this something that you're able to touch on?
Yeah, I mean, it's certainly something that we've looked at when we've been reviewing the evidence around what works, and quite often there's a lack of information about the cost effectiveness of different approaches. But generally, you find that a lot of programs, because the evidence is so consistent on personalised support, a lot of programs will include kind of caseworker support, and kind of take the approach where you have one person kind of working with an individual and taking that kind of tailored, personalised approach. And a lot of those programs do have quite significant returns on that investment. So it can be, and it is, a cost-effective way of providing support. I think there's a kind of, within that, it's important. We generally find that support is more effective if caseworkers have relatively kind of low caseloads. There's instances where caseloads have been too high, so that needs to be managed, and kind of how that kind of that support on that kind of individual basis sits within the kind of wider kind of networks and partnerships that I've talked about. So if you're working with somebody, how can you kind of signpost them and refer them on to some specialist support that is available from a local third sector organisation, for instance, or if they've got a specific support need, and how do you make sure that you join things up? So if you're taking that kind of caseworker approach, how does that sit within the kind of wider kind of partnership working, which is really important for kind of making sure that interventions are cost effective and you're providing effective support to individuals.
Yeah. Thank you.
Can I come in on
Yeah,
that one?
please do.
I think it's a real genuine issue. Actually, economic inactivity isn't the only thing where we see it. It's really common with business support, for example, right? Where you get this thing that the most in-depth programs give the biggest benefit. But my feeling with it is there's no generic answer we can give here, right? Because people's objectives will differ and their local situation will differ. I actually think, though, thinking about the cost benefit is the right question to answer. My feeling is that for most places, the answer is going to be a mix of doing some stuff to address more complex needs for particular groups that they want to target, where the local is really important, but then actually doing a whole bunch of the lower cost stuff that Naomi's been talking about, which are about the system as a whole. How do you increase take up for programs that are funded by someone else? How do you reduce the complexity of the system so that people aren't struggling to navigate it through? So, you're working on actually increasing the effectiveness of the interventions you've got in place rather than creating whole new programs from scratch. So I think, firstly, it's really the right question. I think, secondly, it points to the fact that actually it's not always going to be that the answer is I'm going to have my own caseworkers doing this kind of stuff. A lot of the really hard work will be about improving the effectiveness of the system as a whole. Victoria highlighted, like, a lot of those things to improve take up quite cheap, right? About information and putting people through pathways, etc. And so if we can do that into schemes where the effectiveness is slightly lower than those complex schemes, but it's being paid for by someone else, and it's affecting lots of people, those can be really cost-effective solutions. So I think that a good strategy is going to involve a mix of both, but you just can't get away from doing the hard thinking of working through the whole suite of actions that you've got from a cost-benefit perspective.
Thank you. Victoria, we have a question about DWP and data sharing. Can you? So it's DWP have always been risk averse in relation to data sharing. How do we move past this?
I mean, I feel like Naomi might be better placed to answer this than I am, because I suspect she wrestles with this on a more regular basis than I do. I think there's two different categories of thinking about data. One is about understanding, like, the nature and the scale of the problem that you're trying to address. And I think the other one is, okay, if we're actually trying to target individuals, identifying those individuals. Now, I suspect the question is specifically about the second of them, which is not really in my expertise, so I'll kind of step back from that. On the first one, I think I think there's two things. Number one is, we know there are issues with some of the data sources. So I would encourage people to look at a whole range of different data to try and understand what's happening. But also, I think, like, there's an old joke about economists, which is, how can you tell that economists have a sense of humor? Because they use decimal places. Okay. I think a lot of this is about understanding broadly what's happening. So not worrying so much about last year our rate was 27% and this year it's 28%, because realistically, the scale of the issue in most places is large, and you're never going to address all of that need. So in a sense, I totally get the bit about DWP being a resource to help you target individuals, but if it's more generally about the understanding what's happening, I would focus on making sure that you're getting things directionally right, rather than getting too focused on the specifics. But I don't know whether Naomi wants to come in a little bit more on how you get around the data sharing issue.
Yeah, well, I mean, I think it's absolutely right that you've got to draw on multiple data sources. I think there's been some good progress on data sharing. And I know organisations like Policy and Practice work with local authorities to support them to use administrative data to build up quite detailed profiles at the local level, and kind of track outcomes using administrative data, which requires obviously those data sharing agreements. And I think DWP is increasingly focused on how it can support and enable local partners to deliver employment support and interventions to address economic inactivity. And then you've also got things like the Employment Data Lab, which is an important resource in trying to understand the effectiveness of different specific interventions. So I think there has been some good progress on that front. There's further to go, but yeah.
Okay. We're going to need to leave it there, I'm afraid. If you've asked a question and it hasn't been answered and you work in local government, we do have an online forum where we will be answering those questions. So if you go to khub.net Again, this is only for folks who work in local government. Apologies to everyone else. khub.net, you can find us. We're economic growth in the UK. You can join that group and you can join a discussion with folks from over, I think, over 50 local authorities across the UK. Our next breakfast briefing is going to be next week on the industrial strategy. So it's next Wednesday, same time. Do sign up if you haven't already. You'll find details on how to register for that on the latest part of our website. You can also find on our website the resources that Victoria mentioned. So that's whatworksgrowth.org. If you haven't already signed up for our newsletter, you can find that at the bottom of our website. That's the best way to stay up to date with other activities that we've got. This recording is going to be uploaded onto our YouTube page if you wanted to have a rewatch or if you wanted to share it with colleagues. Thank you so much for your time, and we hope to see you at another event soon. Bye, everybody.